I remember where I first had my first bout of incontinence. I was at a conference and I was at the dinner table and we were eating and drinking and we were laughing. And all of a sudden I'm like, oh my gosh. And I tactfully left the table and went to the bathroom and tried to cover up the loss of urine and the wetness of my pants.
Stress urinary incontinence is when the support that holds the urethra in place gets weaker or disrupted, and so there's leakage with coughing, laughing, sneezing, or activity.
I was pretty embarrassed, and I think I went a long time before I actually did anything about it with my primary doctor.
She was very bothered by her symptoms, and she had tried several options and treatment options that had not worked well for her. At the time, she was not ready to have surgery. She opted for the pessary, which is a ring that goes inside the vagina, and it helps support the urethra. And the good thing about pessaries is that they help improve symptoms relatively quickly after placement. They're non-painful, and they can use it for as long as they'd like.
It really helps to control the leakage, the urgency. The pessary really has made a significant difference.
I think something that's really important about stress incontinence is that the treatment really depends on the patient goals and how affected they are with their symptoms. So there are all sorts of treatment options, and we start with very basic things: behavioral modification, going to the bathroom at certain time periods, avoiding foods or fluids or drinks that might affect your bladder, and we call them bladder irritants. There's also an option of pelvic floor physical therapy, where we would refer you to therapists that have specialized on the pelvic floor. And then finally, there's several surgical options. The more common one is the mid-urethral sling, which is a 30 to 45 minute procedure, outpatient. You go home the same day. Highly effective, highly efficient, that we can offer our patients.
One thing I appreciate about her is that she thinks about my psyche. I've really appreciated her care.
Talk to your primary care or to your gynecologist, tell them about the symptoms, tell them how much they're bothering you. They would be happy to refer you to the urogynecologists, and we will make sure that when you come and see us, you feel comfortable and we find the right treatment options for you so that you achieve your treatment goals.